Well, hey everybody, my name is Guadalupe. I am a therapist at Tuwali OHSU Cancer Center, and I'm here with my partner,
Lisa.
and we're here to show you a couple of videos on how to make a back bag. Now there are quite a few different ways to make a back bag, and a lot of people have a lot of different ways of doing it, so we're going to show you a couple of ways of how we prefer to do it. Alright, so the first bag that we're going to learn to make is going to be a pelvis bag. And these bags are useful in setting up treatments for prostate patients, palliative pelvis patients, rectal patients, and cervical patients. Basically anything from the waist down, this is a great setup for you to learn. So what we're going to work with is an indexing bar, a back bag, a knee bolster, a short pad, and a small wedge and a pillow. These are useful in just helping the patients feel comfortable, and the back bag is usually useful in making sure they're stable and reproducible for each treatment. So the first thing that we are going to be doing is indexing the bolster to the table. And here at Tuwali, we use indexing. Now this may not be the case at other centers, but we do index here. And on the bolster, on the back side of the bolster, you have different indexing. And so that's something that you'll learn from center to center as you go on. So as we index, we just want to make sure that our indexing bar goes right into whichever set of marks that you want to use. So for tall people, you may use a different setting. For shorter people, so now that I have my knee bolster indexed, the next thing I want to do is make sure that my back bag is all the air is put into the back bag, so it's easy to mold around the patient and the knee bolster. So in order to do that, we have what we call just a little adapter to your back bags that allow air to get into the back bag. So what we're going to do is we're just going to place this on the back bag, and that allows us to make sure all the air inflates the bag, and it makes it a lot more moldable and malleable to put over our knee cushion. So one of the more important things is, well, for me, I always like to make sure that I leave room for the legs. So what all I'm doing is moving around the beads in the back bag in order to create a space for the patient's leg. I do this before they come into the room, so that way when you get here and the patient gets here, you're not scrambling to try and adjust. So the key is to make sure that you're ready for the patient before they come into the room. So now that we're setting up for the patient, one thing that I like to do is I like to make sure my pad is movable. So what I do is I place just your average, you can do a pillowcase or a towel, what have you, and I just place that underneath my short pad, so that way if I need to move the patient as I'm setting them up, it moves more easily. Just like that. Now that I have that, I'm going to have my partner bring me a towel to set this up. So we're going to do a sheet real quick. And so we just want to make sure that we have a clean towel, a clean sheet. Go ahead, Lisa. So now we're setting up, and we are set up for our patient. I've already made the mold for the legs. I've indexed the knee cushion. I've put my sheet on top of the setup, and now we're ready for our patient. So Lisa has graciously filled the role as patient. So she's going to come over, and we're just going to get onto the table, just like you would with any other patient. And one of the more important things is, as we're working, I want to make sure her knees, the bottom of her knees, are right above the peak of this bolster. So we want to make sure that the knees are right over the top of this, so that way it helps reduce any pitch variables that the patient will have in their pelvis. So now that her knees are right over this hump in the bolster, we're just going to have her lay back down. There we go. And now it's time to make the bag. So before, the one thing that we need to start with is make sure that the patient is fully aligned, and we use lasers to do that. So now that I have my patient on the table, I need to make sure that she is fully aligned before I start making the back bag. So I've already turned on my lasers. You may not be able to see them, but I am going to focus on 3 areas of the body when making a pelvis back bag. I want to make sure that her SSN, suprasternal notch, is in line with the laser. And then I come down to the body, I make sure her xiphoid process is aligned in the laser as well. I can look at the umbilicus, and then you want to make sure that laser falls in between the legs as well. So now that I have my patient all lined up, I want to focus on making the bag. So the first thing I'm going to do is remove my clip that I added in there to allow the air in, and now I can start molding the bag to how I want it. So important for me at least is I want to make sure that the sides of the bag hug her legs, the patient's legs, and then I also, for a pelvis setup, I want to make sure that I index the feet, the bottom of the feet, because you don't want the patient being able to move back and forth in the bag. So pushing the back bag against her legs and against her feet allow you more stability and reproducibility in your setup. So now that we have made the bag, or pressed the bag against the side of the bag and the bottom of the bag, we're going to focus on the middle of the bag. So this part right here is really important, because if you don't do anything with this part, the patient has the ability to move their legs side to side, and we want as little movement as possible. So what I do is I like to grab this part in between this space right here, and I like to pull up so that way I have enough space to press it against the inside of the calf, against that. So that way you're creating basically a channel for the legs to go into once you take all of the air out of the bag. Now that I've gotten everything where I want it, you will need to take the air out of the bag. Now, when you're doing this, you may not always be with a partner. You may be by yourself when you're creating these bags, so being able to create one of these bags on your own is really important. So once we've gotten the mold how we want it, we're going to take the vacuum and attach it to the bag. And while I'm doing this, I want to tell my patient that you may hear a loud noise, and just let them know and reassure them that it's just the vacuum and it will be loud. So now once I do that, I get the vacuum. Not everybody has a rolling cart. Some are close or far away, but usually most hoses reach to the bag. So what I want to do is I want to make sure that right when I'm about to turn on the vacuum, that I'm still pressing the bag into the legs to make sure when that suction starts that we're not leaving any area that may fall loose or to the side or away from the body. So we finished making our pelvis bag, and as you can see, you can see where her calves are, you can see where her heels are. You have a nice index to where her feet are laying flat against the bag, and you can see right where her legs are being indexed. So also, since we have a nice index on the top of the bag, we want to look at the bottom of the bag, and as you can see, that's indexed pretty well because it took the knee bolster right out of there. But as you can see, there's no room for the bag to move left or right on the index board. It has a nice mold all the way around it. So these are just a couple of helpful tips on how to make a pelvis bag. If you have any questions, feel free to ask Maria or Christy, and we will hopefully be able to answer those for you. Thanks, and come again.